Good morning and good afternoon to all of you joining us for the Fast Track Cities Implementation Science Fund Letter of Intent Development webinar. My name is Jose Zuniga, I'm president of IAPAC, and I just have a few remarks before we start the webinar. First off, I'd like to express our solidarity with you during these difficult times, COVID-19 pandemic. We stand with you and in support of you as you work to maintain a continuity of health services, including in relation to HIV in your various communities. We're immensely grateful for all that you are doing. We're also thankful to those of you who are joining us today to learn more about the newly launched Fast Track Cities Implementation Science Fund that our faculty will be reviewing with you today as we prepare to accept letters of intent from both clinical and community researchers for implementation science studies across the Fast Track Cities network. In January of this year, IAPAC launched its Decade of Action commitments to guide our efforts through 2030. And among those commitments is to coordinate the implementation science agenda that will help us bridge the science to service gap, and therefore help to optimize HIV, urban HIV responses. We're very excited about the newly formed Fast Track Cities Implementation Science Fund that you'll be hearing about today, and we're grateful to the expert advisory committee members who have helped to create the groundwork and the structure for the fund, inclusive of the research topics that we will be reviewing during today's webinar. We're also immensely grateful to both ViiV Healthcare and Gilead Sciences for investing in the Implementation Science Fund and for their long-term partnership with the Fast Track Cities initiative in general. With that, I would like to turn over the webinar to Sindhu Ravishankar, who is IAPAC Senior Director for Strategic Information, to lead us through this webinar. Thank you very much. Stay safe.
Just after the objectives. So I wanted to also give a quick overview of what the Fast Track Cities initiative is. So this Implementation Science Fund is specifically Fast Track Cities Implementation Science Fund. This is an initiative, for those of you who are unaware. It was launched on World AIDS Day 2014, December 1st, when 26 cities signed the Paris Declaration on Fast Track Cities, committing to accelerate their local HIV response, reach the 90-90-90 target, and eliminate stigma and discrimination from their cities. Since the launch in 2014, 300 plus cities have joined the Fast Track Cities network as of this month. And I've included a link here. If you want the full list of Fast Track Cities, you can go to that link. As part of the Fast Track Cities initiative, we've been engaging in several different activities, capacity building for clinicians, community. We have data dashboards, technical assistance for health departments, and now we're excited to bring in this new component, the Implementation Science Fund, the Fast Track Cities Implementation Science Fund. So the Fast Track Cities initiative, it's all about doing the right thing at the right place. We have a focus on cities because about 200 cities account for 60% of people living with HIV. And in many countries, cities have a large, share a large burden of the national epidemic. Cities are laboratories of innovation. It allows for local accountability, and it allows us to do targeted responses using geolocated data. And then the Fast Track Cities initiative, it's all about prioritizing 90-90-90 on a trajectory to getting to zero, leveraging the political will and action of city stakeholders, addressing health inequalities, reaching key and vulnerable populations, and then closing care and prevention continua gaps. So we'll see these themes are going to be recurring in the types of studies and types of implementation research that we're hoping to get from all of you applicants. Okay. So the Fast Track Cities Implementation Science Fund, we launched it actually this year. IAPAC manages this fund with the support of our wonderful expert review committee members. You can see all the members listed here, and we'll be hearing from two of the members, from Steph and from David, in a little bit today. And from From funding through ViiV Healthcare and Gilead Sciences, this year we will be awarding up to 10 research grants to clinician and community researchers in fast-track cities. So then I just wanted to delve a bit into defining implementation science, and Steph is going to go into this in a bit more detail in this presentation. Just to say that there are several definitions out there. So we wanted to provide one definition that could be used standardized for this grant proposal. And so we are defining implementation science based on a systematic review that's commissioned by the World Health Organization as a multidisciplinary specialty that's generalizable knowledge about the behavior of stakeholders, organizations, communities, and individuals to understand the scale of, reasons for, and strategies to close the gap between evidence and routine practice for health in real-world contexts. So with that, I am actually going to hand the presentation off to Dr. Steph Peral from Johns Hopkins School of Public Health, who's going to speak on framing of HIV-related implementation research. So we're going to talk more about the field of implementation science. And afterwards, you'll hear me come on again when we go into more detail on the LOI and the grant overview. So Steph, all you.
So thanks everybody. It's a pleasure to be on. I'm going to give like the briefest of overviews. This is a really busy webinar, and I think a lot of folks are really interested in, you know, some of the elements around the LOIs, etc. I think, you know, my job is just to provide a little bit of additional framing into HIV-related implementation science. So I'm going to do that by talking a little bit about like implementation research methods in practical terms, some conceptual frameworks that folks can consider, and then just like a little bit of introduction into like outcomes and strategies, because I think that's often a topic of conversation. Next slide, please. Great. So, I mean, I think, you know, we often say this, like, you know, like, why are folks interested in implementation research? And I think it is because we at this point have incredible efficacy data about U equals U, about PrEP, but I think, you know, we haven't achieved the sort of, you know, public health impacts that we would have, or at least there's been, you know, significant amounts of disparities in their application. There's been real challenges with bringing interventions to scale. I think, thanks. I think a lot of folks are really interested in terms of understanding like why and how interventions work. And so as we think about which components we want to take to scale, we can really make kind of educated decisions about that. And again, we really want to increase ultimately the impact, the public health impacts of our interventions. And I think probably representing on this call are both researchers and more sort of practice or public health oriented folks. And I think building those partnerships is really at the heart of advancing the field. Next slide, please. The current status of the field in HIV, maybe similar to this presentation, feels a little bit chaotic. You know, I think that like, you know, there are lots of different folks and lots of different individuals working on different approaches. And I think there's been really an initiative, and I think a lot of the folks who are on this committee have been part of that, about trying to create additional coherence in terms of like the outcomes that are being used within implementation research and practice. And I think, you know, the prediction moving forward is that we'll see that increased coherence. I think the types of LOIs that will be, you know, presented now will have more coherence in terms of the types of questions being used than maybe 5 years ago. And I think that's really going to advance the field. And so, you know, I think the idea for today is to really, if folks haven't been introduced to it, talk about some of these outcomes, have them think about them, and try to, you know, integrate that into their LOIs. Next slide, please. Great. So indeed, I think Sindhu made a really good point about definitions. And I think part of what I want to say here is like we get very like kind of hung up on definitions when I think we don't necessarily need to. So, I mean, you know, I think implementation broadly is about the use of strategies to introduce or change evidence-based health interventions. And that can be policies, programs, and individual practices. I think, you know, this work was done with Elvin and Thomas, really led by Thomas Adeni and Elvin Gang some years ago. But at the time, this is about 3-4 years ago, we looked at all the different definitions that existed within implementation science for HIV specifically, and there was 62 different definitions. And I think that really hung up folks. But the reality is that when we looked across these definitions, there was 5 key themes that really emerged, really clearly. And I think, I think like kind of focusing on those themes was probably more interesting and more important than the actual wording of the interventions. Themes included being multidisciplinary, results really focused on being generalizable, as you see, closing the gap between evidence and practice, being done in real world context, and involving lots of different stakeholders. And I think those themes are what many of us would, assume and integrate into what implementation research in HIV should be. Next slide. So, in practical terms, what does that mean? Well, I mean, often we're looking at common implementation problems, right? The common challenges that we have in delivering treatment and delivering PrEP. We want to understand the factors that either hinder or facilitate access to health interventions in terms of coverage. We want test solutions to tackle those implementation barriers. And ultimately, we're also looking for the best way to introduce something new. I think a big question right now is about long acting. How are we going to introduce it? What are the best ways of doing it? And then ultimately, how do we take it to scale and ensure that it's sustainable? So I think broadly, this sort of maps out the types of questions that implementation science and the methods tend to focus on. Next slide. So where does this fit in with other study designs? This is often something that is brought up. I think there is, this is an area where we don't need to be overly pedantic. The reality is that there's a lot of overlap in the actual methods used between quality improvement and kind of operations research, M&E, obviously T3 and T4 studies. I think the focus on implementation research is always that eye towards, what of this work can be used by others in other settings. And so whether it's generalizable or whether it's just really paying attention to context, there's a real focus on ensuring that others could look at the data that are being generated and use it in their settings. And I think that is a little bit different than like a traditional operations research study, for example, that is very much focused on just that program. I think a lot of implementation research folks are really thinking about what can others more broadly learn from the work we're doing, in addition to the work, informing our own program. Next slide. So I think some of the characteristics of implementation research are, are something to consider. So one is, we want there to be, findings that are warranted to inform a policy or program. So that means really talking to, people who make decisions around policy and programs and understand like what are the types of data and evidence that they need. What is sufficient evidence? Is it an RCT, observational data, quasi-experimental studies? Like what is it that they're ultimately looking for? And I think those conversations early are particularly impactful for like research utilization purposes. But there's also an element about really ensuring transparency of methods that would allow critical assessment of the study. So are the processes adequate? Are conclusions justified? Repeatability? And I think one challenge that exists sometimes in the research practice partnerships is that, I think there's an element of like not wanting to be afraid of failure from a research perspective. And what I mean by that is like a well done, non-impactful study. Sometimes programmatic agencies can have challenges with that to like kind of go back and say, well, we didn't reach impact. So I think trying to think about like the right balance between being able to do a study that's, well done, but also is kind of like transparent in its methods and its conclusions is really important. Is one of the things that needs to be worked out early in the context of transdisciplinary work. Next slide, please. So one other thing to consider with implementation research, and I think this is probably reflected by who's on the call, is that like traditionally for like efficacy work, it's mostly research folks sitting in, their academic centers and developing methods and developing questions. And I think here we want to think about as we're assembling the team itself is like, what representation do we have from government agencies, frontline health professionals, communications folks, privacy folks. Often we're leveraging data that are being collected for other means or administrative databases. So understanding the privacy implications early of the types of plans that we're putting forward is really important. And obviously a stakeholder assessment. I think we'll hear more about that from David, about really talking to our communities in meaningful ways and ensuring that we're doing something that is of value. Next slide. Okay, so conceptual framework. I think, the idea about conceptual frameworks is there's lots of them. And I'm going to spend a few minutes talking about this now. So, there's some that you hear about a lot. REAIM, the stages of implementation from the National Implementation Research Network. you know, the CFR, the Consolidated Framework for Implementation Research. But just to say, as you'll see, next slide, please. There are many, many, many different frameworks. And I think ultimately, you know, there is value. I'll just say is, you know, there's great value in looking at these frameworks and building on the work of our peers, right? So, you know, they've thought through many of the same issues that we have, and they've kind of provided you an approach for data collection, for hypothesis generation, for evaluation strategies. And so I think sometimes, you know, people get kind of overwhelmed by the frameworks, and the reality is that, you know, you don't have to use all of them, but reading some of them actually can be really valuable in terms of like further specifying not only your question, but actually the types of methods and the types of data collection that you're planning, both quantitative and qualitative, I'll note. Next slide. So, I mean, I just this is like, normally we give entire lectures on this, but I'll just say there's sort of like broadly, you know, like planning and process frameworks. And so, you know, EPIS, exploration, preparation, implementation, sustainability, K2A, REAIM, really kind of give you ideas about steps along the implementation pathway. There are implementation determinants frameworks that, you know, really kind of give you insights into the things that have been seen to be important for implementation. And then there's the more sort of evaluation frameworks. And, you know, you can use one from each of these in the same study that, you know, depending on sort of what is ultimately the goal. And the last thing I'll just say about these is that you don't have to use every piece of the framework, that there may be pieces of it that you see as to be particularly relevant for the questions that you're asking and the work that you're doing. And it doesn't by any means suggest that you have to collect every, like CFR has the 5 main constructs. Under each, there's between 15 to 20 subconstructs and domains, et cetera. And so there would be hundreds and hundreds of pieces of data that you'd have to collect. And I think the folks at CFR have been really great about showing that you don't need to do all of it. You just need to focus on what is most important to you. Next slide, please. So this is a resource. It's been shared, I think, with the LOI, but it's such a great website that kind of helps you get an idea about like what is it you're trying to do, and then we'll give you suggestions of like the right, you know, frameworks and models that you might consider. Notably, I didn't talk about models and theories today, but you know, it will also provide that. Next slide. So I'll just talk about outcomes briefly. I think traditionally within the types of research that we all do, we really focus on health outcomes, either at the individual or population level. Like the gold standard has traditionally been thought of as like incidence or DALYs and QALYs, et cetera. I think there was a move towards like service outcomes, you know, like coverage outcomes, efficiency, allocated technical efficiency. And now, you know, as of the last 11 or 12 years, you know, Enola Proctor put forward the implementation outcomes. And so, you know, you see these outcomes here. You know, often people don't realize how much work has gone into actually developing indicators and specific measurement approaches for each of these. So I'm just going to briefly just introduce that in the next few slides. Next slide, please. So, you know, the point of an implementation outcome is asking this question is like, is the program doing what you had intended to do? And if it is, then it's, you know, is it resulting or not in a positive outcome? That's the effectiveness outcome. And I think the question is like, only when we have our evidence-based interventions like fully implemented, do we expect that positive outcome? So outcomes, the implementation outcomes are broadly the results of an implementation process. They can be used to evaluate the success of implementation. They represent proximal indicators of implementation processes and are intermediate to what we expect to be ultimate effectiveness outcomes. But they are in rapid development. You could think of them as underdeveloped constructs. They're not as clean as incidents, and they operate across lots of different socio-ecological levels. Next slide. So this, you know, this is like the standard slide that many of you have seen. It just gives a little bit more detail into what is a working definition and related terms that are often used. But I just want to spend just 1 or 2 minutes on the next slide, giving you an idea. So first about fidelity. So, you know, even with fidelity, people have gone through, you know, great work to really define like what are subconstructs of fidelity. You know, a construct that's often used is Carroll's, published now, you know, 13 years ago, and it lays out, you know, different subconstructs within fidelity and the types of things, if you go to the papers and the ones that have used it since, the types of things that you might want to measure. I should also note the Society for Implementation Research Collaboration has also gone through and cataloged all of these. So the idea is like, it doesn't just have to be like, if you want to measure fidelity, that you have to develop it, that it's really been laid out for you if you want to use it. Next slide. And I'll just say, even for adaptation, and so I think I won't focus on this that much, but I'll just say that there's been a tremendous amount of work into asking questions about like adaptation, levels of adaptation, how to measure it appropriately, quantitatively, qualitatively. So this is really just like, you know, that if the focus for you is you want to adapt the program from one place to another place, you know, there's Adapt It, which is a great framework, and then there's also the sorts of measurement approaches that have been laid out for you that you might want to consider using. Next slide, please. So another thing that we often talk about, and this will be, I think, the last thing, is really like implementation strategies versus like implementation. And so if we think about an implementation intervention, it's a method to enhance the adoption of a clinical intervention. And strategies are really, there to improve the process of care. And so, you know, the idea is that these are efforts and approaches that are designed to support an intervention. And I'll say that, next slide, you'll see this, that it's really about like separating out the intervention that you want, you know, into the different types of strategies. So we recognize, for example, like if your intervention is with individual providers, there's lots of different things that you can do for that. You can provide them education, you can provide them incentives, you can provide them accreditation, job aids, checklists, etc. So it's really about thinking like, what are the key elements within the broad intervention area that I want to focus on, and then ensure that the implementation outcomes match to those, that you're evaluating something that's related to the strategy that you're focusing on. Next slide. So just obviously this isn't a methods talk, but I'll just say that, you know, increasingly we have sort of broadly like three broad types of experimental studies. Like we have like explanatory studies that are really, you know, our traditional gold standard, traditionally focused on, you know, individually randomized control trials and try to highly control conditions. So have sometimes questionable generalizability or transferability in the absence of measurement of context. And so there's a real focus on term validity. Pragmatic trials are really where we take, you know, an intervention in real world settings and normally try to just implement it and try to maximize generalizability. And sometimes it kind of comes at the risk of increased internal validity, or I should say decreased internal validity. The thing that I'll say here is that from an implementation perspective, there are like effectiveness implementation trials, type 1, type 2, and type 3. Type 1 normally being where you're powered on an effectiveness outcome and you're including implementation outcomes. Type 2 might be where you power both on effectiveness and implementation outcomes. And type 3 being where you are maybe evaluating multiple implementation strategies and you're powering based on those, but you may also collect some effectiveness data that may be unpowered. I should note that you can do those both with like traditional RCTs or pragmatic trials, and that likely that will represent, for those folks interested in randomized designs, will likely, you may fall into one of those three buckets. And there are a lot of people arguing that we shouldn't be doing anything in HIV that's not at least a type 1, like just collecting some implementation indicators as you go. There's a lot of work into adaptive designs. I'm obviously not going to talk about it here, but you know, you can look at, you know, preference-based designs, adaptive based on outcomes, smarts, etc. And so just to say, there's a tremendous amount of effort in that space. Next slide, I think the last. Yeah, so I mean, ultimately I'll leave you with this, which is that like our traditional efficacy paradigm was like, treatment, does it work? It's like, of course it does, right? And then people want to scale it up. I think that, you know, the questions that maybe you're being pushed to ask here is like, you know, can you make this particular intervention work in your setting? What are the conditions that you would need to meet in order for it to work? And if you can meet those, then, you know, asking the questions about iterative and adaptive scale up, and then ultimately the goal is the same, which is about impact at scale. So with that, I'll finish. Thanks.
Thank you, Steph. I'm going to now hand it over to David, who's going to be speaking a bit on community-based research and then what community can do with implementation science research, and we'll be giving a couple of concrete examples from his home country, France, on implementation science studies that are taking place. So David, it's on to you now.
Thank you, Sindhu. First of all, I will give you a short definition of what we called community-based research and what are the link between community-based research and implementation science. So, in fact, for us, community-based research is research. There is no question about that. It's a research that responds to the same methodological requirements and rigor as any other scientific research. It's not a low-cost research. The specificity of community-based research is that we try to build a balanced partnership between researcher and community actors. And the idea is that we do research together. We is our researcher and community actors. So we do research together, guided by the needs and the knowledge of the person who are concerned by the question or the problem. So to say that differently, it is based on the principle of doing with the people and not doing for the people. And above all, the goal of community-based research is social transformation. So what about the links between community-based research and implementation science? Community-based research is not necessarily the synonym of program evaluation, interventional research, or implementation research. We can have some biomedical trials with a community-based approach. There are a lot of surveys on key population based on community-based approach. But in many cases and projects, question about implementation of services, dissemination of new interventions, access to services are central in community-based research. So very often we do implementation science and research without knowing we do it. And that means that without any doubt, community-based organizations do have a lot of things to submit at this call of tender. Next slide, please. So now I will provide you with two examples, which are very complementary with the speech of Steph, and I choose to present two different types of study. The first example is the ANAS CALIPEP study, which aims to examine the leverages and barriers to access to pre-exposition prophylaxis. So the context in France in 2013 was this one. So we didn't really have national data on the number of people using PEP. We didn't know really good their practices, and we didn't know their profiles. PEP was a little known tool, and there was a lack of information about this tool. We field workers were also aware of a lot of missed opportunities and difficulties of access to PEP. So the hypothesis of the study was to, if we better understand the barriers and leverage to access to PEP, we would have some solution to improve the access to this offer. So the main objectives of the project was to characterize the use of PEP among the groups which were most exposed to HIV. The second objective was to interview the experience of prescribing PrEP by the healthcare. And finally, we wanted to assess the acceptability of a community PEP offer. Next slide. Next slide, please. So to do that, we used a qualitative methodology. We choose to focus on a specific geographic area in the Alps region near Lyon, and we did interviews with different group of people. And we analyzed this material. So the result was conduct to improvement proposal for access to PEP. So improve information for the most exposed public, improve training of emergency doctors, and harmonize the protocols, improve training of the screening center staff, and the study shows that it will be useful to advocate to change guidelines to have a better tolerated treatments and review their duration. And we also showed that community PEP offer, the idea of community PEP offer was very acceptable by people, so we proposed to experiment it. So some of these proposals have been retained and applied by authorities, and the guidelines were changed, but we are still waiting for community PEP. The next slide, please. Sorry. The second example is a bigger project, but I only want to speak about the evaluation side of the project. So the Hermetic project was a European project which aimed to link mathematical modeling and experimentation of new intervention on testing. So with the mathematical modeling of the epidemic, we had identified the hidden epidemic, and in fact, the hidden epidemic in France, a large part of it where people who don't know their status are migrant men from sub-Saharan Africa. So the question was for Ed, how can we improve our capacity to reach these individuals from sub-Saharan? Based on the literature review, brainstorming and discussion with the field workers, we decided to experiment a new approach to HIV testing, which had been never tested, never experimented in Europe. It means door-to-door testing. So the questions, the research questions were, is door-to-door testing more efficient to reach sub-Saharan individuals for screening? Is this new intervention acceptable by people and by field workers? Is this new intervention feasible? Next slide, please. Next, Sindhu. Sorry. So to respond at these questions, we use a mixed method, qualitative and quantitative. First, we use our testing data, and we perform an analysis which compared testing data of a classical intervention with testing data of the new intervention. We also passed a questionnaire about acceptability with the proposition of testing, and we did interviews with the field worker. And the result of the study was that we effectively reach more native sub-Saharan African with the new intervention compared to the classical one. And it appears that that the intervention was acceptable and feasible by the people, but also for the field workers. So after this experimentation, we didn't have implement this new testing strategy in all the sites of ED, but it was a very useful experimentation to modify some points in our intervention guidelines, and we have a reflection about how can we implement this new strategy now. Thank you.
So just first wanted to provide an overview of the grant that is coming out of the Fast Track Cities Implementation Science Fund. We will be providing up to 10 grants to clinician and community researchers. So 5 clinician researchers, 5 community researchers, up to $50,000 US and a 10% capped indirect rate. And it's for a duration of a 1-year-long project. This excludes any time that might be needed for local ethics or IRB approval, because we understand sometimes those processes are longer and tedious. 90% of the $50,000 has to be spent in country where the research is taking place. So applicant eligibility, this grant is specific for community and clinician researchers who are based in a current Fast Track city. If you are a researcher that has multiple affiliations, you have to have at least one affiliation with a community-based organization or NGO or a clinical facility. And if you are an applicant who has both clinical and community affiliations, for example, a doctor who has who also works with an NGO, then you must specify which category you're submitting under. And the reason for this is because we do want to make sure there's an equal distribution of grant funds that are going to support community researchers and clinician researchers. So although the primary applicant needs to be either a community or clinician researcher, you can include up to 3 subrecipients from other organizations, so nonprofit, for-profit, community and faith-based, government, other NGOs, or other institutions such as academic institutions that would be relevant for this grant. And the proposed study should address implementation gaps in existing evidence-based interventions, policies, and programs across the HIV care or the HIV prevention continuum. I won't read through all of these. These are on our website, but as you see, we have several different domains that we will accept proposals for. But I do want to just emphasize that we're not looking necessarily for the creation of new interventions, because we are talking about a one-year-long study with $50,000. Rather, we're looking to see existing evidence-based interventions, policies, and programs, and how those can be scaled up or implemented with different kinds of communities or really built on. So focus is on existing interventions, policies, and programs and how to effectively and efficiently implement those. So the first step for this grant, and that's the whole purpose of this webinar, is the development of a letter of intent. So for those of you who are maybe not with a lot of times we have a letter of intent, which is a briefer overview of your proposed project. And based on that initial letter, we invite select applicants to submit a longer proposal. So right now, we're speaking to the letter of intent development stage, and these LOIs are going to be due on July 20th, 2020. All of this information is also on the website, but just to go quickly over it, we have 6 sections that you need to include in the LOI. The LOI can be 3 to 4 pages in length. It will have an introduction and background, so you know, what is this project about? Objective and relevance. Why is it relevant to one or more of the domains that are listed for this grant? And what is the objective that you're trying, the outcome that you're trying to achieve? What is the implementation framework and methodology? So we do want some kind of structure around the project on how you're going to implement, how you're also going to capture data, and what you're going to do with the data. We have on our website a document called Resource and Guidance. That document actually goes in much more detail, different guidance documents and tools that define implementation frameworks. And Steph also in his presentation shared one tool that kind of lets you choose what kind of research that you're doing, and it auto-generates a framework for you. So that might be something that you're also interested in if you haven't had experience working with implementation science frameworks before. Then there's the data evaluation and analysis plan. So how are you going to be collecting the data? How are you going to be analyzing it? The intended outcomes, you know, what are we trying to achieve from the grant? And then the proposed timelines. LOI should include all of these sections. Additionally, along with the LOI on the letterhead, there is a supplemental information form. This is also on the website. The supplemental information form includes applicant information. So this is just the organization's information on the primary focal points, and then a mission statement, organizational mission statement or capability statement. It includes an illustrative budget. There's a template already provided, and then a key personnel statement. The key personnel statement is meant to be somewhat brief. We want to know the roles that you plan to be part of this project, what the capabilities of that role will be, and specific to this grant, what that person or that role is going to be achieving. At the proposal development stage, if you are invited to submit a longer proposal, we will ask for NIH format biosketch, which is a bit longer, but at this LOI stage, we don't need that much detail. And then the last thing is a conflict of interest form, which will be posted on our website later today. So the review of the letter of interest and what some of the next steps are. As I mentioned in the beginning of the presentation, we do have a wonderful implementation science expert review committee. They will be reviewing the LOI submissions against a standardized rubric. I put a little image of the rubric here. So there are 5 areas that it is going to be reviewed against. So significance, is the proposed research identifying implementation gaps? Is it going to have any kind of impact or potential impact on policy and practice? The second domain is approach. I won't go through all the questions, but you can kind of review this on your own. The third is value. Value is more about the cost. So is the cost appropriate for the project that's being proposed? And are the funds being efficiently used, or the resources being efficiently used? Then we have organizational investigator capability. So the primary applicant, are they proposing something that their organization has the ability to carry out? And then the last is sustainability. So beyond the 1-year scope of this project, will this project have some kind of effect or impact beyond that 1 year? So those are the 5 areas that the submissions are going to be reviewed against. And then, as I mentioned, select applicants based on the LOIs are going to be invited to submit a full proposal. If you are invited to submit a full proposal, we will be having a proposal development workshop that's going to be led by some of our expert review committee members. So it'll give you the opportunity to ask more questions, think more critically about how to structure the implementation structure the framework and the methodologies, and how you want to collect data, the timelines and the budget. You'll have the opportunity to really craft that and ask any questions of our expert committee members. And then the full proposals, and again, I'm getting ahead of myself. We're not at the full proposal stage, but just so you are aware, the full proposals will be reviewed by the expert review committee and by IAPAC, and up to 10 grants will be awarded. As I mentioned, we do want equal representation of community and clinician researchers. So we're thinking 5 community grants and 5 clinician grants. So that is all that I had for the review of the grant and the LOI, which is, again, the deadline is July 20th. So we can open it back up to questions now. So, and thank you everyone for attending. Please do be on the lookout for a follow-up webinar, which will be the same content, but we hope with others who weren't able to attend can join that, and we will be following up again with the presentation, the recording, and the FAQ document. So thanks all for taking time today, and if you have any other questions, please do email us and we'll get back to you as soon as possible. Thanks.